Hello there, and welcome to my clinic. My name is Dr. Calliope, and I take it we have not met before. That's why we're doing this new patient comprehensive examination. Very good. Okay. So let me just grab a little bit of info from you real quick. Okay. Would you mind just telling me your full name? Good. And your date of birth? Excellent. And is your full name your preferred name, or do you have something else that you'd like to go by? Okay, and that's how you prefer to be addressed. Wonderful. Thank you. Okay, so it looks like you are in the market to establish care, right? Okay, so is there anything in particular that you are looking for in a provider? Okay. Good. Okay. Yes, those are good things to look for. So you have the power here in that you know what you're after and what kind of care you're looking for. So I hope that going forward that I can match that standard for you. So I'd like to ask you just a couple of preliminary questions. All right. Do you currently have any pain or illness that you would like to address? Okay, very good. And any health conditions that I should know about? Okay. Okay. Good. Anything else? No. All right. And what does your family history look like? Is there any history of, say, cancer, diabetes, heart disease, asthma, anything of the sort? Even mental health conditions like ADHD, bipolar disorder, depression. Okay, very good. And any allergies at all? And we could group in, say, intolerances as well, like lactose intolerance, or, for example, I have a carbohydrate intolerance. Yeah, let's write that down. Good. Okay. Any other allergies or intolerances? Okay. And what kind of medications are you on? Okay. And what is the dosage? Okay, and that's good. And what was that prescribed for? Okay. Alrighty, so in terms of supplements, you would be able to get those yourself, but yeah, I just wanted to know what kind of medications that possibly I would take over prescribing for you. And it gives me a little bit of detail into your health as well. So, are there any other concerns that you wish to discuss? No? Okay. do let me know if at any point anything comes to mind. For example, if you are interested in genetic testing, screenings, anything of that sort, okay? All right, so I'd like to conduct a general examination to get a baseline of your current health and anything we need to watch out for in the future, or anything that maybe is not a problem right now, but we should be addressing later on. Okay? All right. So I'm going to sanitize my hands real quick before I touch you. For the purposes of the exam, I will need to be touching you at certain parts. Is that okay with you? Do I have your permission to do that? Wonderful. Thank you. Okay. We are all fresh and clean, so let me just take a little peek at your vitals. Okay, good blood pressure. Pulse is a little high. Yeah, that's pretty common. Okay, good oxygen saturation. Okay, yeah, everything looks pretty good. So, I'm going to be working down from your head down to your feet, and we'll be going over different systems. Like, we'll start with the integumentary system, we'll look at the sensory organs, we'll look at the heart, the lungs, we'll look at the circulatory system with checking your circulation, and we'll look at the lymphatic, and we'll go over just about everything, okay? All right, if at any point there is any pain or discomfort, please let me know so that we can take a pause, all right? Okay, so I'm going to start at your head. I want to look at your scalp. I want to look at your hair. I want to look at the actual contours of your head, okay? So I'm just going to be palpating around the head to start, and then we'll take a look at the scalp itself, as well as the quality and texture and characteristics of the hair. Okay? All right, so if you could just stay still for me. There we go. There. Just palpating the skull. Have you had any head injury? No history of concussion. Okay. And I didn't see anything in your surgical history, right? Okay, just wanted to ask real quick. Okay, so the actual head feels pretty good. So I'm gonna look at the hairline now. So just stay still for me. I'm gonna peek through each side of the head here and behind the ears. Good. Do you experience any sensitivity to fragrance or any sort of skincare, hair care product? Good. I'm just going to take a look at the scalp a little bit. Okay, so not seeing any signs of psoriasis, seborrheic dermatitis, or any infestation, infections, things of that sort. Okay? So I'm going to take a little peek at your hair. All right? So I want to note what its texture is. Is it coarse? Is it fine? What kind of wave pattern we have? Straight, wavy, curly. What its strength is. If we have signs of alopecia, if we have an excess of shedding or any spots of hair loss. Okay. Okay, that's just a couple of hairs there. So I just comb my hands through your hair a little bit. Good, okay. So hair looks to be in good condition. Let's take a little look at your face and around the skin on the upper body. So again, just hold still. Do you have any concerns at all with your skin? Okay. Yeah, nothing like hyperpigmentation or cystic acne or excessive dry or oily skin, things of that nature. I see. Very good. Okay, and texture looks good. Okay, just noting what the oil distribution is. Do we see signs of rosacea, things of that nature? Okay. And I'm just going to take a peek at the neck, chest, the arms a little bit. And we'll look for any abnormal signs in the skin. Do you experience itching, hives, burning? Okay, yeah. Just making sure. I want to make sure we are covering our bases. Okay, and if you could just show me your elbows real quick, I can look for any plaques around the joint. Okay, very good. And if you could just lay your arms, relax. Let your arms relax, or lay them and relax them. Okay. Good. And let me just take a peek at the nails real quick. We won't check the capillary refill yet, but I want to look at the quality of them. Okay, good color to them. Do you bump them a lot? Well, I suppose it's not exactly a lot, but more than a few times. Okay, so that's those little white bang marks there. Just making sure. Okay, Very good. Looks great. You can now relax the arms. Good. Alright, so start looking at some sensory organs, and we'll start with your eyes. So when's the last time that you have seen an eye doctor? Okay, and do you normally wear glasses or contacts? And are you colorblind? Okay, well, I believe you, but I'd like to double check. We'll go through just a few plates here. The Ishihara test for color deficiency. Okay, so I'm just going to hold up some pictures and I want you to tell me what the number is in the middle of this plate. What's the number in the middle of this plate? Good. That would be a 12. Okay. And what about the numbers in the middle of these plates? Very good. We have an 8 and a 6. And what about in the middle of these plates? Good. We have a 5 and a 3. And last one. What do you see in these plates? Yes, so these, to someone who isn't colorblind, just look like an abstract pattern. Very good. So, no color blindness. Our little screening. And then let's take a look at the eye. So I'm going to get pretty close here. And I want to make sure the eyebrows are intact, the eyelashes are intact, that the tear ducts are pink and moist. The sclera is clear. We're not seeing any signs of jaundice. There's no injury to the eye. Okay, and I'm going to look at your conjunctiva. I'm going to pull your eyelids up and I'll have you look down. I'm going to pull them down and I'll have you look up. Okay, I'm going to pull them up, you look down. Good, and I'm going to pull them down. You look up, up. Good. Okay. Now I'm just going to take a peek with my light here. Okay. You just hold still. You could just look at my nose. I'm going to check on the pupils. We're not going to be doing too much with the eyes today. This is just general health. Get a bit of a baseline. any issues with eye pain, strain, fatigue, itching, blurriness, wateriness, dryness? No. Okay. Very good. Okay. Those pupils look pretty good. They're responsive to the light. Equal, round. Right. Let's check in on those ears, shall we? So, are we having any problems with our hearing at all? No. Okay. Anything like higher voices being harder to hear, lower voices, talking on the phone, listening to something while there's noise in the background, anything of that sort? No. Okay. Any ear pain? Any feelings of fullness in the ears? Do they feel hot at all? Are they itching? So, let's check your hearing a little bit. Okay? Alright, we'll do the louder one first. So this is a 512 hertz tuning fork. It's a higher pitch sound. And I just want you to close your eyes for me and tell me which side is the sound coming from. Okay? Close your eyes. Good. Mm-hmm. Good. Mm-hmm. Very good. Right in the middle. Okay. And now I'd just like to whisper some words in one ear or the other, and I want you to repeat them back to me. Okay? All right. Turquoise. Shoelace. Flashlight. Pencil. Book. Very good. Flower. Mirror. Plaid. Hardwood. Beige. What about those words? Good? Any difficulty at all? Very good. So, let's take a peek inside the ears. I am going to grab my otoscope and we'll just swirl this together. There we go. Swirl was kind of an odd word to use, was it not? We'll swivel the head on, screw the head on. Those would have worked. I suppose swirl is technically correct, but an odd choice of words. I think that's the problem with having so many synonyms in the English language. Even though there are many things that are technically correct, they're not exactly right. For example, even though the words butt dial and booty call technically should mean the same thing, they absolutely do not, do they? No. So, we've popped a speculum on for your sanitation purposes, and I am just going to be flipping the light on and inserting the otoscope very gently into the ear. I want you to hold still. I will be steadying myself so that if you do move, then I'm not going to poke you at all, but do your best to just stay still. Okay? Alright, let's pop that on and let's take a peek. Alright, good. And have you had any problems with a buildup of cerumen in the past? I see. So you've done some ear cleanings then, I assume? An ear cleaning connoisseur. Now you're speaking my language. I just want to note how the canal looks, the distribution of the little hairs, the quality of the cerumen. Is there any impaction? Things of that sort. Go ahead and pull that out. And then we can come to the other side as well. Good. And we can look for things like how the eardrum looks, the tympanic membrane. What's our color? Is it translucent? Is there any perforation? Is there any bulging? Any signs of infection? Things like that. Can we see the tip of the malleus behind the tympanic membrane? The cone of light, is that present? All these little bits. Okay. Alright, let's go ahead and just pull that out. Okay. Wonderful. So how was that? Was there any pain or discomfort with that? Okay. Hearing looks great. And let's take a peek at your nose. So let me replace our speculum. We'll get a new one. Have you had any problems with your sense of smell or taste? Okay. And have you noticed any postnasal drip, any stuffiness? No? Any burning or itchiness in the nose? Good. And do you snore or have any problems breathing when you sleep? Okay, very good. There we go. Our last speculum was not quite fitting on there. So if you could just tip your head back for me a little bit. This will not be coming inside the nose, but it does help direct the light a little bit. Okay, let's take a look at the septum and the inside of the nose. Okay, do you often suffer from seasonal allergies? No, okay. Right, that septum looks good, it's midline, no perforation. Okay, everything looks good up there. Go ahead and put your head back. We won't need that speculum again. Okay, I'd like to press a little bit around the nose and the sinuses and check on them a little bit. Okay? So I'm just going to very gently press, 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 press. Any pain or discomfort with any of this? No. I'm going to do a bit of direct percussion on the frontal ethmoid and maxillary sinuses. Do let me know if there's any pain or tenderness here. Just going to any pain or discomfort here. Nothing? Very good. All right. Let's take a little peek inside of your mouth. All right, so have you had any problems with your teeth or your mouth or your throat? Okay, not so much. All right, no cold sores? No? Okay. And your lips are a good color. Have you noticed if they've gotten very pale or even maybe a dusky color at all? No? Okay. And do they ever get oversaturated where they look really red? No? And no swelling? Okay. And any problems swallowing? Any problems with hoarseness of voice? Alright, let's go ahead and take a peek. So if you could open your mouth for me. There we go. Okay. And let's check around. Look at the tongue, the teeth, the oral mucosa. See if we can look at the little salivary glands as well. The palate. Okay, and if you could say ah for me. Okay, uvula is midline as well. Alright, throat looks good, no signs of cobblestoning. No color difference, doesn't look like there's any irritation. Okay, no sign of the tonsils either, or at least enlargement rather. Okay, and I am just going to take a peek here. Good. Alright, and can you lift your tongue to the roof of your mouth? Wonderful. And can you stick your tongue out? Good. And can you move it to one side, the other, and up, and down? Wonderful. You can put your tongue back there. We are chugging along. Let's take a look at your lymph nodes. Have you had any problems with any enlargement in any of the nodes as far as you know? No? Alright, so we're going to take a look at everything from the back of your head, behind the ears, front of the ears, under the jaw, along the neck, and above the clavicle here. Alright, so if you could hold still for me. Good. Let's just at the occipital nodes here. Okay. And then how about postauricular? These are behind the ear. Preauricular. Okay. And the parotid gland. Good, and let's do under the jaw. We have submental and submandibular. Okay, and then let's go to the neck. We have quite a few nodes here. We have posterior cervical, we have superficial cervical, deep cervical chain. Lots to hit in this area. Good. And then let's go to supraclavicular, above the clavicle. Okay, and those all felt normal. Let's move on to the heart and lungs. So we are going to do some auscultation. And I just want you to breathe normally for me, okay? All right, and I'm just going to put this on your chest. This is the diaphragm of the stethoscope. So first we hit aortic. Then we go to pulmonic. Then we can grab tricuspid. And mitral. And let's hit Herb's Point while we're here. So, have you felt anything like palpitations? Have we had any shortness of breath? Do you have any chest pain? Okay, nothing like that. I'm gonna take your pulses real quick if you don't mind. So, we're going to do our pulses on both sides. I'm going to hit radial, ulnar, brachioradialis while I'm here. Good. The other side. There you go. Just relax your wrist. Good. Your pulse has noticeably slowed down. That's good. A lot of that, I think, is just rushing in. Doctor's office seems like a harrowing experience when you first get in there. You're not sure which door they're going to come in, when they're going to call your name, where you're going, especially if you've never met them before. Good. And I am going to check both the radial pulses at the same time. And this would be looking for something called a radial delay. Okay, those are pretty equal. And while I'm doing pulses, I'm gonna just check the carotid pulse real quick. I'll do one at a time. Both those at the same time is not very nice. Just check right here. Okay. Good. Let's bring back our stethoscope and let's check on the lungs. So, have we had any problems with breathing, any wheezing, any pain when you're breathing? Okay, and lung capacity seems normal to you? As it ever has, yeah. Okay. All right. If you could take a deep breath in for me. And out. Deep breath in. And out. Deep breath in. And out. Always comparing one side to the other. Deep breath in. And out. 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 Okay. So, I would like to auscultate your abdomen before we put away the stethoscope, if you don't mind. Okay. We do this first because once we start messing with the abdomen, then we start changing how it sounds. Just breathe normally. You're doing really well, by the way. Been a model patient. Okay. And any issues with digestion? Okay, and we're not having any problems like if you eat bread or pasta or milk or anything like that? No? Okay, very good. So let's go ahead and do some palpation here. I'm going to start with a medium pressure, okay? And then I will do a deep pressure, and I'll use 2 hands for that. I'll just have you breathe through it, okay? It's not very fun, but it doesn't last very long. It can be a little intense though, okay? So I'm just going to press in on your stomach. I do wonder sometimes why the euphemism for the abdomen as a whole is stomach when that's like way up in the side. I mean, I suppose it'd be odd if we called the entire thing like our liver, but it feels a little strange to say, oh, my intestines hurt or something like that. Oh, you can feel it deep in my intestines. That's a little weird. I guess stomach is about as polite as we can get while still making some semblance of sense. Good. Deep pressure is not fun, but it doesn't last very long. Okay, that is just fine. Okay, we are nearing the end. We're going to look at hands, arms, legs, feet, and reflexes, okay? And then we'll circle back. So, if I could take a look at your arms, I just want to check the temperature real quick, the backs of my hands, of the joints and the skin. Looking for any changes here. Good. All right. And let me look at the capillary refill in the nails. So I'm just going to take each nail, press it down firmly, let it go. Okay? Press, let it go. We want to see that color return in less than 2 seconds. Good. It's pretty much instantaneous for you. Thumbs are just a bit more sluggish. But those fingers doing just fine. Okay, that looks pretty good. Have we had any problems with the joints of the fingers, the wrist, the elbows, shoulders? No pain, no swelling? No. Okay. And how about the skin itself? It's been doing okay? Alrighty. Let's go ahead and look at the legs and feet. We did a little bit of a look-see earlier with the integumentary system. So we'll move on to the legs and the feet. So I want to look for any skin abnormalities, especially along the shins. Okay, and look at the pulses as well. So let's check popliteal, and that's behind the knee. Okay. And then we can get the pulse at the foot. Okay, let's feel around the ankle. Good. Alright, doesn't seem to be any edema here. Have you had problems with excessive or inappropriate fatigue in the legs or the feet? Any issues with balance? And any swelling in the legs or feet? Okay. Let's check capillary refill. So I'm going to be pressing on the toes, just like I did with the fingers. We've got good circulation there. And any pain in the toe joints, in the ankle joints, knees, hips, anything of that sort. Okay. Let's go ahead and grab, there we are. I'm going to grab our Tromner hammer here. And I'm just going to tap along you from ankle to, well, there's not even really anything up here. So ankle to arm, I suppose. So let's go ahead and grab the Achilles tendon reflex. Okay. You could just let your foot dangle here. Good. Okay. And the other side. Just let your foot relax. Very good. And then let's get the patellar reflex. Excellent. And let's go ahead and grab the biceps reflex. So I'm going to curl my hand around your elbow and put my thumb right in the crook of your elbow and strike the hammer on my thumb. Okay. Good. And the other arm. Very good. And let's hit triceps. So I'm going to take your arm. We're going to put it like this. I'm going to take the weight of it. Okay. Up we go. And then I'm just going to hit the back of the elbow here. Good. And bring it down. And other side. Just let the arm relax. Good. Okay. Let me go down. Now, while technically we could do the jaw jerk reflex, one's really not tested unless we have reason to believe there might be something going on there. A normal response would be essentially no response at all. Okay. All right, so we've hit our major bases. So that will be wrapping up our examination, unless you have anything that you wish me to look at. Okay, very good. So we've been here for a little bit. Is there anything that you recalled that you had any concern about or wanted more information on? Okay, very good. So let me go ahead and sign off here. Excellent. So I hope that I was up to your standard for a possibility for you to establish care at my clinic. Okay. It was a pleasure having you. I really enjoyed having you in the office. Thank you so much for coming in. I really appreciate it. I hope you have a whale of a day and a good rest of your night. Thank you.